Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Hip fractures, a serious concern. These injuries can have a profound impact on the lives of those affected, especially older adults. A hip fracture is a break in the upper part of your thigh bone. This bone is crucial for supporting your body's weight and enabling movement. This bone is called the femur. It is the longest and strongest bone in the human body, playing a vital role in our mobility. Hip fractures are serious injuries. They can lead to significant pain, loss of independence, and even life-threatening complications. They are common in older adults. As we age, our bones naturally become more brittle, making us more susceptible to fractures. Falls are the most common cause of hip fractures. Simple activities like walking on uneven surfaces or slipping in the bathroom can result in a serious injury. As we age, our bones can become weaker. Conditions like osteoporosis further increase the risk of fractures by reducing bone density. This makes us more likely to break a bone in a fall. Taking precautions, such as using assistive devices, can help mitigate these risks. Hip fractures often require surgery. Surgical intervention is usually necessary to repair the broken bone and restore mobility. The recovery process can be long and difficult. Rehabilitation and physical therapy are crucial for regaining strength and independence. It's important to take steps to prevent hip fractures. Maintaining a healthy diet rich in calcium and vitamin D can help keep bones strong. You can do this by keeping your bones strong and preventing falls. Regular exercise, balance training, and home safety measures are key to reducing the risk of hip fractures. Falls are the leading cause of hip fractures. These incidents can happen anywhere, but they are most common in the home. Simple activities like walking to the bathroom or getting out of bed can lead to a fall, especially if there are hazards like loose rugs or slippery floors. This is especially true for older adults. As we age, our bodies undergo various changes that can affect our mobility and stability. As we age, we may have problems with balance and coordination. These issues can stem from muscle weakness, vision problems, or even certain medications that cause dizziness. Regular exercise and physical therapy can help improve balance, but the risk remains. This can make us more likely to fall. Everyday activities can become hazardous, and even a small misstep can lead to a serious injury like a hip fracture. Osteoporosis is another major cause of hip fractures. This condition, which weakens the bones, is often called the silent disease because it progresses without symptoms until a fracture occurs. This condition weakens the bones, making them more likely to break. Regular bone density tests can help diagnose osteoporosis early, allowing for treatment to strengthen the bones. Osteoporosis is more common in women, especially after menopause. The decrease in estrogen levels during menopause accelerates bone loss, making postmenopausal women particularly vulnerable. But men can get osteoporosis too. Although less common, men also experience bone density loss as they age and should be vigilant about their bone health. Other factors that can increase your risk of a hip fracture include a previous hip fracture, which can weaken the bone structure and make another fracture more likely. A family history of hip fractures can also be a significant risk factor, as genetics play a role in bone density and strength. Low body weight is another risk factor, as less body mass can mean less cushioning during a fall. Certain medical conditions such as rheumatoid arthritis and diabetes can also contribute to weaker bones. Lifestyle choices like smoking and lack of physical activity further exacerbate the risk. Long-term use of certain medications, such as corticosteroids, can weaken bones over time. It's important to discuss these risks with your healthcare provider to manage and mitigate them effectively. If you think you or someone you know has a hip fracture, it's important to seek medical attention right away. Here are some common signs and symptoms of a hip fracture: severe pain in your hip or groin, inability to walk or stand, swelling and bruising around your hip. Your leg may appear shorter on the side of the fracture, and your leg may turn outward on the side of the fracture. Section 4. Diagnosing a hip fracture. Your doctor will ask about your symptoms and medical history. They'll also do a physical exam. This will help them assess your pain and range of motion. To confirm a hip fracture, your doctor may order imaging tests, such as an X-ray, which is the most common test used to diagnose hip fractures, an MRI, which uses magnetic waves to create detailed images of your bones and soft tissues, and a CT scan, which uses X-rays to create cross-sectional images of your bones. Section 5. Treatment and prevention. Treatment for a hip fracture usually involves surgery. This is often necessary to ensure proper healing and to restore mobility. The surgical procedure can vary, but it typically involves either repairing the fracture with metal screws, plates, or rods, or replacing part or all of the hip joint with a prosthesis. The type of surgery will depend on the location and severity of the fracture. Your surgeon will review X-rays and other imaging studies to determine the best approach. In some cases, minimally invasive techniques may be used to reduce recovery time. After surgery, you'll need to wear a brace or cast to protect your hip. This helps to keep the bones in the correct position as they heal. The duration for which you need to wear the brace or cast will depend on the specific nature of your injury and the type of surgery performed. You'll also need to do physical therapy to regain your strength and mobility. A physical therapist will guide you through exercises designed to improve your range of motion, strengthen the muscles around your hip, and help you return to your daily activities. Consistent therapy is crucial for a successful recovery. Here are some things you can do to help prevent hip fractures. Maintaining a healthy lifestyle is key. Get enough calcium and vitamin D, exercise regularly, avoid smoking, and limit alcohol consumption. These nutrients are essential for bone health, and regular exercise helps to keep your bones strong and your balance steady. Make your home safer by removing tripping hazards, such as loose rugs and electrical cords. Ensure that your living space is well lit and that you have handrails installed in key areas like staircases and bathrooms. And talk to your doctor about your risk of osteoporosis and whether you need medication to strengthen your bones. Regular checkups and bone density tests can help you stay ahead of potential issues and take proactive steps to maintain your bone health. UMCC, your ultimate medical consultant connector.